Okay, this is my case study on sickle cell anemia. Sickle cell anemia, by definition, is an inherited blood disorder consisting of malformed hemoglobin molecules leading to the breakdown of red blood cells, which results in red blood cells taking on a sickle-celled appearance, or sickled shape appearance. Anemia is a deficiency of red blood cells, or hemoglobin. Sickle cell anemia is a type of hemoglobin, and it predominantly affects people of African or African American descent. Approximately 1 in 12 people from this lineage carry a sickle cell gene, according to the American Society of Hematology. Let's have a look at the components of blood. Red blood cells are responsible for carrying oxygen around the body, also known as erythrocytes. Additionally, they exchange oxygen or carbon dioxide for oxygen once they reach the lungs. White blood cells are responsible for defending against disease and other foreign materials, also known as leukocytes, and platelets, which are responsible for stoppage of bleeding when vessels are broken by creating a thrombus or blood clot. These are known as thrombocytes. And let's have a look at the components of blood again. Plasma is what suspends the formed elements, that is the red, white blood cells and platelets, and other dissolved materials. While this allows the blood to move through the body, move through the cardiovascular system, and blood works to provide nourishment to cells and to carry away waste materials, and also provide some immunity functionality for the body. So the sickling of red blood cells occur when the mutation of the beta globin gene, which causes the cellular structure to deform. This creates an abnormal production of hemoglobin S, or hemoglobin sickle, which creates a rigid and sickled shape for the red blood cells. Additionally, hemoglobin S tends to form a polymer, which is not an ideal structure, and also provides the rigid shape and rigid structure that sickle cell blood cells are known for having. So sickling of the blood cells can cause complications such as strokes and hypertension and kidney disease. Healthy blood cells are flexible so that they can move through the smallest blood vessels and the tight vasculature of the human body. Sickled cells are rigid and can get stuck in vessels, which can reduce blood flow, and in some cases, this blockage can also turn into a thrombus. Additionally, the heart needs to beat harder than usual in order to move sickled cell blood throughout the body. So according to the American Society of Hematology, which describes strokes and acute chest syndrome to be some of the worst complications related to sickle cell anemia. Having a look at strokes, in addition to the stiff sickle shape, people with sickle cell anemia also have an increased production of thrombin, and this combined pathological issue can cause blockages and even ruptures in the brain, which lead to strokes. So let's have a look at acute chest syndrome. Acute chest syndrome is a vaso-occlusive crisis which causes ischemia and therefore necrosis, which can release bone marrow and fat into the venous circulation. These particles can subsequently travel to the lungs, which triggers further vaso-occlusion. occlusion, and ultimately causing acute chest syndrome. This can lead to hypoventilation, hypoxemia, and infection due to the pain and poor oxygenation of the body. The blood carries nutrients such as vitamins, minerals, fat, and protein around the body. However, the shape and rigidity of sickled cells significantly impairs the ability of endothelial cells to exchange nutrients with. The slowed blood flow also impacts this process, and the heart needs to beat harder in order to move this increasingly viscous blood throughout the system, which can result in hypertension. Red blood cells from sickle cell patients have shown a significant decrease in potassium permeability compared to those with regular blood cells. Poor potassium permeability can have negative impacts on muscle activation, which can lead to easy overexertion, which is a symptom that Cherry Blossom, our patient here, is experiencing. She experiences fatigue, and fatigue can be related to poor permeability of potassium. Smoking leads to poor oxygenation saturation in people with regular blood cells. In the case of Cherry Blossom, having sickle cell disease, smoking, even during stress, can further complicate her symptoms of fatigue and cold skin. And this is because carbon monoxide has a high affinity with red blood cells, almost as much as 250 times more than oxygen does when it reaches the lungs. This reduces the ability of hemoglobin to deliver oxygen to the rest of the body, because instead of oxygen binding to the hemoglobin, carbon monoxide will instead. Treatments. Well, medication can be used to reduce the pain in sickle cell anemia patients because the blockage of blood flow causes pain for many sufferers. However, in some cases, opioids such as morphine, hydromorphone, and diamorphine may be used. Blood transfusions are an effective strategy when dealing with sickle cell anemia. Blood transfusion programs should be initiated targeting a hemoglobin S or hemoglobin sickle level of less than 20% after transfusions, which would hopefully replace the sickled cell cells with fresh, new, and healthy blood cells. Oxygen therapy, while effective during crises, would not be an ideal long-term solution for sickle cell anemia. And that's because while it shows a reduction in irreversibly sickled cells, known as RSCs, it does not show a reduction in irreversibly sickled cells. Infection prevention. Sickle cell anemia patients are more likely to experience infections such as the flu, meningitis, and pneumonia. Cherry Blossom and patients alike will need a special vaccination schedule to reduce the risk of infections, according to the Centers of Disease Control and Prevention. While it is nice that Cherry Blossom does not engage in drinking, her smoking habits negatively impact her already low oxygen saturation. Educating Cherry on these impacts and offering potential solutions to mitigate her smoking habits in the future will have a positive impact on her saturation in the future. And here are some of my references.